My name is Andrea Merriam. I'm with the Parkinson and Movement Disorder Alliance, and we are thrilled to have you. And I'll pass it over to our neurologist facilitator, Dr. Indu Subramanian, to tell us who our guest is and what we're going to be talking about today.
Great. Well, welcome everyone. I know we're still physically distanced here and heading into the holidays, but we're socially connecting, and we hope that you're all doing well and staying safe, and that you and your loved ones are generally well. I know the numbers are surging, and we just want to urge everyone to take that extra level of precaution as these, the coronavirus continues to spread throughout our communities, and really think about those healthcare providers that are on the front lines trying to give their all. So we just want to, give a shout out to them and our caregivers out there as well. It's Caregiver Support Month as well, and so wanted to shout out to all of you and your families, and hope everyone's doing okay. So, so I'm excited to bring this topic to us. When we sort of came up with the series over the last several months, we weren't sure exactly how it would all pan out, but I think this is perfect timing. I know that I've been feeling a little bit more stressed and a little more barriers towards my own physical wellness and health. So I think I'd love to hear from Ali here to motivate us, get us through the holidays, and stay on track with our exercising. So without further ado, I wanted to introduce Ali Kraus, who's a physical therapist. She has a doctorate in physical therapy. She's out in Florida now, but I know just reading your CV, you spent some time in Ithaca, some colder climates, and made your way out to Florida to join Mike Oken and his amazing team. We've had a number of your colleagues on the series, and continue to just be awed by your amazing multidisciplinary team there. So Ali, maybe without further ado, we can learn a little bit about your journey in becoming interested in physical therapy in this population of Parkinson's. And maybe you could also help us to understand a little bit about folks that are trained specifically in neuro-PT and even movement disorders PT. Help the group out there, because many of people are joining from across the globe at this point, to understand sort of what that additional training is, and maybe why they might seek out sort of somebody like you.
Yeah, thank you. And I'm so happy to be here. Thanks for having me. I'm really excited to be here around the holidays. Getting moving around the holidays is definitely important, but especially during this time when we're all kind of stuck at home. But I am a neurological physical therapist, and within physical therapy over the years, we've really started to specialize more and more into different areas. And I think it's only for the benefit of the patients that we see. So just like within medicine, you go see a neurologist, you could go see an orthopedic doctor, you can go see your primary care physician. Physical therapy has really started going that way as well, to allow us to specialize and really understand the components of movement a little bit more. So I would not be somebody that you would go to after a total hip replacement. I would not be somebody who you would go to for knee pain or back pain. So a neurological physical therapist is somebody who treats more of those neurological conditions. So patients who've had a stroke, patients who had a traumatic brain injury or a concussion, patients with Parkinson's disease or multiple sclerosis, and then any of the neuromuscular, ALS, muscular dystrophy, those type of diagnoses that don't really respond to your regular strength training, stretching, no pain, no gain mentality. So I think it's really beneficial, because I can't tell you the amount of patients that I've come across in my years at the movement disorders who have had those bad experiences and are very anti-physical therapy, because they say, well, I see a physical therapist who sees 3 other people at the same time, and they give me exercises and send me on my way, and then I don't know what I'm doing. And that's not really a neurological physical therapist. A neurophysical therapist, you usually have a one-on-one session with the therapist for 45 minutes. And you might not go as frequently, right? Because you're not going to get rid of the disease. We need to teach you how to manage it more independently. And just from the chat, looking it up, you guys are all very active already. So you don't need us to exercise. You just need us to teach you the right ways to exercise and how to modify it as the disease affects you in different ways. So a neurological physical therapist will really know more of the intricacies of Parkinson's disease. And I think some of those barriers that we'll touch on today are covered in that, and how it's important to address these barriers. And if you go to a regular orthopedic PT, they might get missed. And so the intervention might not be as successful as it could be. So,
That's really
and
great.
it goes across the spectrum too. So I started in acute care neurology. So you, in the hospital, somebody post-stroke, somebody with Parkinson's disease who's had a pneumonia or something like that causes them to be in acute care, and then move to outpatient. And I fell in love with the diagnosis of Parkinson's disease from a physical therapy standpoint, because I saw how beneficial movement is for you guys. And I don't need to tell you that. My patients tell me that. So I think learning how I can help you stay moving has been an area that I really enjoy doing, and trying to figure out, okay, I have pain here, let's adapt it this way, and keeping you moving and keeping you guys doing what you love. So
That's amazing. Well, I think that's so much part of the puzzle, right? Is we can figure out the right exercises. We know that exercise is medicine, but how to sustain that and make people want to do it day in and day out. And how I think, we were talking even earlier about the caregivers and how a lot of them feel frustrated that they are, they feel like they're the sort of, the cheerleader, and they would exercise for you if they could, but they can't. They really have to motivate that person that they love to get up and do it. And so, I think these barriers are so important, and I think we want to keep all of, the dream alive, and keep thinking about how to surmount these barriers in the best way we can, leading through the holidays into the new year. And maybe you can inspire us a little bit as to really how to sort of tackle all of these things. So I know you put together a great blog for us, Ali, and we'll point folks in that direction. Mike and I have been, Dr. Oken and I have been writing a blog together weekly, and it's been really fun. And we've highlighted some of the great work that so many of our folks, and I think we've had 3 or 4 physical therapists at this point on, including Julie Hirschberg, who's one of my local favorites. Becky Farley, who's an amazing therapist who has really done some amazing sort of pioneering work in the PWR kind of approach to this, and then your great team as well. So I will let you maybe show us some of your presentation. I know you have a lot of content there, and you'll make the slides available to the gang, and then we'll also point people in towards your blog, and hopefully we can keep inspiring people.
Yeah, sounds great. All right, let me share my screen. Can you guys see those slides?
Yep, perfect.
Okay. All right, so I already had the great introduction, but I did start in upstate New York, where it was much colder, and trying to exercise through the summer and through the winters was a whole different ball game up there. But what I'm learning is the summers in the South is very similar. You have to adapt your exercise. And I think as we get going, one of the components of breaking these barriers with exercise and keeping you moving is exactly that, is changing it up. I think there's a lot of benefit to not doing the same thing all year long, because at this point, we don't have a cure for Parkinson's disease. So trying to keep you going for the long haul of this disease and not get burnt out with the same exercise routine every day is going to be really challenging. So trying to do something in the winter and something different in the summer can be a component depending on where you live. So now I'm at the Fixell Institute in Gainesville, Florida, and I also teach for the physical therapy program at the University of Florida. So I always try and figure if I can teach them all about Parkinson's and exercise, at least there's a lot more students out there for you guys to have access to that will help you in your process. So I wanted to start with, I'm just one little circle on the team. And I know you guys have the opportunity to listen to all these different people throughout the months and throughout the blogs. So I'm just coming at you from one perspective on how to break down these barriers. So at our facility, and I'm sure a lot of the access that you guys have, there is a huge team of people. From the caregiver is a huge component, like we were talking about earlier, and how they can help and how they sometimes need a break from being the person that is the motivational person that to rely on. And relying on more of a social worker or a support group like you guys are doing is super beneficial to your care, because you are the middle person and we try and revolve around you to help keep you doing what you're doing. So the role of a neurological physical therapist does look a little bit different than what we talked about, like the orthopedic physical therapists, they do a lot of pain. You usually don't go to a physical therapist unless you have pain. And I would say the majority of my patients don't necessarily have pain. So we see them a lot of times from the time of diagnosis. So you're diagnosed with Parkinson's disease and you get sent to a physical therapist. And most people say, why do I need to be here? So our goal is to see you before there's a problem, rather than waiting for you to have a fall and then get referred to physical therapy. I would rather see you from the time of diagnosis to teach you about how to prevent falls and how to stay active. So within our treatment sessions, we can do different components of fall prevention, balance assessments, walking assessments, sit to stand transfers, asking you if you're dizzy. And then the real component today is going over exercise and activity. From the time of diagnosis, teaching you that exercise is super important with this diagnosis and what kind of exercise, and if you need to modify your current exercise routine, or if you're good staying how you are, and see you again later. So we try and check in with our patients every 6 to 12 months. When they're coming to see their neurologist, they schedule an appointment with me, and I do the same outcome measures every time. And so you can track them over time. So with the disease, I'm comparing you to you to you throughout the disease process and nobody else. And so if there's a change in your balance, if there's a change in your walking, if for some reason you're not exercising anymore, we get on top of it right away, rather than waiting for maybe a year, 2 years down the line, you saying, you know, I'm not moving as well anymore. I think I need a physical therapy assessment. Maybe we could have caught that 6-month mark and before it became too much of a problem. So today we're going to focus mainly on techniques that we give patients in session to talk more about their exercise and their activity during the day. So these were just some general barriers that I wrote down in the blog. And so I kind of went off of that for today's session. Some of the main complaints of patients when I see them in clinic as to why they're having trouble moving around, or why they're having limitations with getting exercising. So rigidity, being stiff, toe curling, dystonia. It can affect your cervical. Some patients have cervical dystonia. I didn't go into that as much. Mainly toe curling and how it affects patients who want to walk and who want to ride a bike. Apathy, we know this is where we rely on those caregivers a lot, and how we can break down some of those barriers of apathy. Balance changes. A lot of patients say, a lot of you wrote in the chat, hiking. And so if you have balance issues and you can't hike, and that's how you used to like, what you used to like to do for exercise, how we can adapt that, or how we can attack it. And then recently, more financial limitations that started with, like, I don't have financial limitations to have a stationary bike in my house or go to a gym. But even more recently, COVID precautions, and how now we can't all go and do our boxing groups or our support groups that we relied so heavily on before. And then back pain and arthritic changes, things that are more age related. We know this disease affects an aging population. So sure, you have Parkinson's disease, but what about the fact that I also have arthritis in both of my knees and I can't exercise? How do I address that? So I'm going to try and give you some tips to take home with to address those different areas. Oops. So we'll start with rigidity. So rigidity, as you guys know, is one of the cardinal symptoms of Parkinson's disease. I always tell patients, in addition to tremor, one of the biggest things we see is stiffness. And it can cause low back pain. And a lot of times patients will complain about their legs just feel heavy. They feel like they're walking through quicksand. And sometimes patients will even complain that their legs feel weaker. And we know a lot of times it's not weakness, it's that stiffness. So starting your exercise program with a stretch is super beneficial for any type of exercise regimen. This is just a video. There are hundreds of videos online if you want more that are specific to Parkinson's disease and stretching, but doing just a lower body and trunk warm up, making sure that you prime your muscles. So before you go for a walk, doing some trunk rotations to loosen up your back, I know a lot of you know the LSVT big move. So doing like the floor to ceiling, the large amplitude movements before you go for a walk. Give your muscles a chance to warm up so that when you go to walk, you're not feeling like you went from 0 to 100. You're giving them that fluid and that mobility to keep them to move easier when you're going through your exercise regimen. I always say this is really important if you're going to do strength training, right? So if you're going to do squats or a leg press where you're working on your hip muscles, you should stretch your hip muscles before you get on that machine or before you do that squat, because your muscles just don't move as fluidly as they used to. And so if you can go through some full range of motion stretching before you do the strengthening, you might actually feel stronger. So it addresses that rigidity component in your muscles. Your muscles just don't move as fluidly as they used to. And so if you're saying, well, like every time I go to exercise, I just feel my legs feel so heavy and I can't get going. Start with a stretch and see if we can work to improve to the point where it's not as stiff to start. Let me just see. I lost my cursor. Here's just some. Feel that stretch. Just some general, you can see she's just pulling one knee over to the other side, just nice and easy range of motion to test the other side of her body. Here, she's just probably going to do like a bridge that everyone's used to, lifting your hips up, extending. If you've been sitting all day, your hip flexors are really tight. So if you can just do a glute bridge and lift your hips up, you'll loosen up those hip flexors so that when you go to stand and walk, you're not going to feel as tight. One of the other components that I think is important to incorporate is timing. So you want to try and exercise when your medication for Parkinson's disease is working the best. So during your peak point of medication. So if you take your medicine every 4 hours, you don't want to exercise at the 4-hour mark. You want to exercise right around the 2-hour mark, because the medicine is trying to decrease the rigidity from the inside, right? The dopamine will help to try and improve your mobility and decrease the rigidity. Excuse me. So if you're trying to take your meds and then exercise right away, you might not get as much benefit out of that medicine. And so that when you go to walk, you're stiffer. Whereas if you take your meds and wait a half hour to an hour, your muscles might be loosened up a little bit more and you'll feel better when you're walking, because you're affecting the rigidity a little bit more. So trying to exercise during your peak point of your medicine rather than fighting the stiffness. So these are just some general exercises that we give to patients. I'm sure some of you have seen them, if not all of you have seen them before. I tell patients, Parkinson's tries to pull you in forward into more of the fetal position. So any stretch that you can do to extend your body and rotate your body will help loosen you up before exercise. So this one is just a lower trunk rotation that can be performed lying in bed. If you don't want to lie down, you can do it standing up. Oops, sorry. You can do it standing up with a stick or a golf club. I saw a lot of you guys wrote down golf as your activity for exercise. Golf is great for exercise because it's social, it's outside, it's balanced, it's enjoyable. But adding in a little stretch before your golf will help you significantly with your golf game. A lot of my patients say that they can't hit the ball as far as they used to, and that may be because of your rigidity. You can't get that trunk rotation to get your full swing. So trying to do some stretching specifically for your trunk and for your upper body and your hips before you go golf may actually help your golf game. So the next topic that some patients have trouble with is more toe curling or foot dystonia. So this happens in patients with Parkinson's disease when you get that cramping in your foot. And so a lot of times it prevents patients from walking. And if that's your enjoyable exercise, which a lot of you wrote down, then it's going to hinder your overall exercise and you're going to get frustrated. A lot of times it can also happen when you're riding a stationary bike. So the way the foot pedals are, depending, it can almost trigger more of a dystonia and pull that foot even more and cause more cramping in the foot. So these are just some general exercises to make sure that we keep your foot loose. And they're good for anybody because, again, we know your body can be rigid, but it's beneficial specifically for patients who are getting that toe curling or foot dystonia. So you can massage the bottom of your foot properly with COVID precautions. You can go get a pedicure where they can spend some time massaging the muscles in the bottom of your foot. It will help to relax those muscles so that when the dystonia kicks in, it's not so painful. If you are a golfer, you can take a golf ball or a lacrosse ball and roll the bottom of your foot on the ball just to try and relax those feet muscles. We always, our toes cramp and then we put them in a shoe. And a lot of times that causes more cramping because it's a smaller space. So giving your foot room to just relax and stretch out is super beneficial and will help pain that can come from the toe curling that may limit your exercise. You can even do just ankle joint mobilization, which a PT can help you with if it gets challenging enough or painful enough, or you can do it to yourself, just moving your ankle up and down, pulling your toes apart and making sure that those joints stay loose, moving your toes up and down, making sure that the mobility in your foot stays, that the stiffness from the dystonia doesn't cause prolonged stiffness in the joints of the foot. So another thing is shoes, making sure that you have the correct shoes to try with your walking or with your biking. Talk to a physical therapist, depending on what your foot specifically is, how it's affecting your day. But a lot of times a wide toe box like this one has can be more beneficial because it gives the foot more room to flatten out. And so it's not constricting it as much. And there are sandals too. Again, I live in Florida. I have to be accommodating to my patients who it's so hot, you wear sandals, but taking a sandal with a heel strap versus a sandal with a flip flop is going to be better for toe curling. Or even trying and sleeping where you're stretching out your toes to help maintain the mobility will help in the long run for the toe curling. Apathy. This is one that's really hard for patients. And I think the majority of my sessions with exercise are probably discussed about this topic. So patients will say, I used to be an exerciser and now I just don't have the oomph. I just can't do it. I used to like to exercise and now I don't. And now I'm mad at myself for not exercising because I know it's good for me, but I just can't get up and do it. And I tell them, I start by saying, it's not you, it's the disease. And we need to address the fact that this is the disease. It is not you. And let's try and take some different approaches. So one, making sure that your movement disorders neurologist knows about this and knows that it's affecting you and that we're tracking it over time, because it can not only affect your exercise, but your social engagements, your family interactions. Like I said, I'm going to come at it from the non-medicinal medicine component of it. But this is more, you can discuss different techniques with your neurologist too. So from a physical therapy standpoint, we talk about the buddy system. And I think this goes to the November being caregiver support month and how much we rely on our caregivers. And so a lot of times it is them trying to be that motivational component. And so sometimes maybe we need to call in reinforcements. We need to have a neighbor that relies on, that kind of gets you up and going and tells you to come for a walk with them. We need to have another patient with Parkinson's disease who maybe you've met at one of your support groups, kind of be your motivating person. I think there's caregivers we rely on caregivers for so much, and you guys are the backbone behind what we do in rehab. But I think that sometimes it's too much for you to also do this day in and day out. So trying to find a buddy system outside of your caregiver to let this be your caregiver's time to do something else on their own can also be beneficial. So you guys are already doing it, but a virtual support group or even a virtual exercise group. There's so many exercise groups currently now that are all online. So maybe the caregiver can be a support and be there to guard you and make sure you're okay, but you can interact just like we're doing now with that over online, since we can't do it in person now. One of my favorite components is write it down on the calendar. So I highly doubt you guys miss doctor's appointments or physical therapy appointments because they're on your calendar. But when it comes to exercise, a lot of times we just say, we'll do it later, we'll do it later, we'll do it later, and then it never gets done. So take your calendar for the week and write, okay, I have physical therapy on Tuesday and I have a neurology appointment on Wednesday. So on Monday and Thursday and Friday, I don't have anything. So let's write down where I'm going to start for my exercise. And not only pick the day, but pick the time. So we just talked about how medicine timing matters. So I know I take my medicine at 12. So at 1 o'clock, I'm going to try and go for a walk for 30 minutes because it's where my medicine is, I have the most energy during that time, and write it on the calendar. Physically writing it down so it's part of your weekly routine is going to hold you more accountable than just saying, I'll do it later, I'll do it later, I'll do it later. When you say that, that's when that apathy creeps up and says, no, just sit down. You don't have to do it. So making it an appointment, just like you would anything else that you wouldn't miss, I think can be a really big benefit for you. And especially during the holidays, everyone has so many things coming up during the holidays. So we all know you're probably not going to exercise on Thanksgiving. Maybe some of you are. That's impressive. I will not be. But on Friday, I know at 9 a.m. on Friday, I'm going to get up and go for a walk or for a run. And so making your week with your holidays, with your family responsibilities, with social responsibilities, and then fitting an exercise into that routine. So especially when we don't have the Rocksteady boxing groups that you can go to, or the spinning groups that you can go to, and you have to kind of be more independent, a schedule might help. And then fitness trackers. I find these help a lot with our patients, having not just you get a fitness tracker, but your caregiver get a fitness tracker, or a brother or a daughter or a son get a fitness tracker, and check in on each other. Set some goals that you think are realistic and try and see, okay, right now I'm only doing 3,000 steps. So next week I'm going to try and get 3 days where I get over 6,000 steps. And it can track you that much easier, and it helps you set some goals. And don't forget the rewards. You got to make yourself a reward. If I get all these, if I do 6 weeks where I get over 6,000 steps a day, I'm going to go buy myself a new pair of shoes so I can go exercise more. So yes, goals, but also rewards. What do you get for doing it? And it kind of makes it more engaging, again, especially during the holidays. A lot of our patients will complain about, well, I used to walk for exercise, or I used to like doing Zumba at the gym, but now I'm so fearful of falling because of my Parkinson's disease, or I've noticed recently I have balance changes that I can't really exercise the way I used to. So one of the approaches to this is maybe that's time for a physical therapy assessment. I didn't even write that on here, but if it's getting to the point where it's interfering, and maybe you even haven't had a fall yet, but that might be the time to kind of go back and check your walking tests and your balance tests and get some physical therapy before you have a fall. But if you want to try some things on your own, I would try a treadmill versus walking outside, right? So a treadmill you can hold on with your hands. The treadmill, if you scuff, like if one foot has more slowness in it than the other, you can sometimes hear it. So it gives you some feedback, and you have to pick up your feet and move them a little bit easier. If walking is too challenging, you could do a stationary bike. So getting that cardiovascular exercise another way is super beneficial. So it allows you to hold on for balance, and it allows you to do that task-specific training. I think walking is one of the most beneficial things you can do for exercise for Parkinson's disease, because it does challenge your walking. So Parkinson's affects your walking. Practicing walking is one of the best things you can do. So if you can progress to a treadmill, maybe that's another option. If not treadmill or a bike, you could try some strength training. So you could do free weights, you could do machines, which are challenging right now with gyms, or even resistance bands. They sell them on Amazon now too, where you can focus on some leg strength. You can do leg presses, you can do sit to stands, and then you can focus on your posture. A lot of times balance deficits affect you more because you start to lean forward more. So working on those back strengthening muscles to help you stand up taller will also help improve your balance and improve your confidence. So when it comes to your overall exercise, whether it's the treadmill or the stationary bike, you want to try and work in that challenging, moderate to challenging routine. These are where we know that there can be some disease modifying effects of the exercise. So if what you're doing is you're just riding the stationary bike and reading a book and just kind of hanging out and not really getting those cardiovascular effects, we might need to bump it up a little and do maybe intervals or something like that. So you could change up the domain. Or if you think your balance challenges, another component I say is take it head on. So if you notice your balance challenges, let's find some exercises that address balance. So Tai Chi, I saw a couple of you wrote that in the chat. That's a huge benefit for your balance. It works on that weight shifting side to side and left to right and where you are in space. Yoga is really good for your balance. It can work on your core stability. So maybe these are areas of exercise that you haven't ever explored before, but might be a benefit, and you can do them from your house now more than anything else. So there's also balance exercises online that you can try and find a YouTube video. This is, again, one that I just had an undergraduate student who had been training with us for 12 weeks or so go over, and you can see just some of the movements she's doing are more maybe Tai Chi related with the weight shift side to side. Doing them near a chair so you feel a little bit more comfortable would be beneficial, but just kind of challenging your balance in different components will improve your balance. I always tell patients, as we get older, whether or not you have Parkinson's disease, your balance tends to get worse just because you don't challenge it, right? Think about a little kid who's jumping on the playground and spinning and running. We just try to avoid things because we're afraid of falling. So some of the balance components that we need to work on is safely challenging your balance. And that might mean that you need a physical therapy involvement. It might mean like this, that you can try some at home with a chair nearby, or that caregiver that wants to help out nearby just to kind of support you. But trying to find ways to challenge your balance is what will eventually help improve your balance. And then where we are now, right? So you guys probably all had great support groups and boxing classes that you would go to help the apathy and to help keep you moving. And then COVID hit and it was all taken away. So how do we stay active with all of this? And luckily, I think if anything positive has come out of COVID, it is the amount of resources that are available just from your house, just from the comfort of your living room, and what you can do from your home. Like this, for example, but also some of the exercise programs that go with that. So the National Parkinson's Foundation, every Friday, and they just released a new one, so they're still doing it, is releasing what they call a Fitness Friday. And they're all about 15 to 20 minute videos that are exercises for patients with Parkinson's disease. Some of them are easy, some of them are really challenging, but going through them and picking different ones on different days to just give you 15 minutes of exercise. I know some of you said you do the Rock Steady boxing. So this is the boxing group that they have right now. They did about 3 boxing videos, but they have lower body stretching, and they have a video specific for posture exercises. They have a video specific for upper body stretching, coordination and balance and cardio. So kind of exploring what different things you can find online will help you and keep it fresh, right? If you're somebody who does your LSVT big exercises all the time, it can get redundant. And a lot of times when it gets redundant, we don't do the same quality that we would when we started. And so trying to change it up and move your body in different ways and keep your body guessing has a lot of benefit to it. Live Zoom classes. So looking into your local support groups, if not more national support groups on different areas that you can get involved in for boxing classes. Locally, and I can send it if you guys want, we have our Dance for Life patients. So we usually have a Dance for Parkinson's class locally, and we can't do it in person right now through the University of Florida, so it's all online. And so a lot of times recently, we've been able to give access to people that wouldn't normally have access to the Dance for Parkinson's disease. So trying to find an area that you like. I have a lady who loves Zumba, and so I spent 20 minutes finding the best Zumba classes for her online that she can do from the comfort of her home, because we can't right now with COVID precautions, and she loves it and does it now. So I know sometimes it's scary to do some videos, exercises at home, but trying some different ones, and some you'll not like and some you'll like. This is Yoga with Adrienne. She's just a general lady on YouTube that I recommend to patients with Parkinson's disease that goes very slowly with different yoga moves. So for beginners, if you're at that point where you want to incorporate some core strengthening for yoga, finding going online and just doing yoga for beginners, she's a good person to start with because she describes the positions and takes it really slow. So that might be a good option for you too. And there are even apps. If you're somebody who's tech savvy and want it all on your phone, there's an app that's the 7-minute workout for seniors that you could try and do from the house. And it's completely appropriate for patients with Parkinson's disease. Or Silver Sneakers has an app that you can use for different exercise classes. So there's a lot online now, as you guys are finding with this, that can really help you get through these times that we don't have the support groups in person. And then how about those back pain and hip pain and knee pain that is very common with patients with Parkinson's disease? And it may or may not be related to patient with the Parkinson's disease itself, but maybe more something that they have a comorbidity of. So the good news is if you were to go to a physical therapist for back pain or hip pain, a lot of the exercises that they would give you are also things that we would prescribe you for Parkinson's disease. Trying to think maybe a little bit more with arthritic changes in back pain or hip pain or knee pain into the strength realm. So with Parkinson's disease, we focus a lot on mobility and range of motion, stretching, and then balance and cardio. If you're somebody who has more arthritic changes, we might need to add a little bit more strength training into your exercise program. So you can do things. So if it's back pain, you can do planks from home. And if you can't do a full plank on the ground, you can see there's 2 variations of planks you can do from your countertop or your bed or your couch to try and start to increase those strength muscles in your deep low back and your deep core. If it's hip pain that hurts more and affects you with walking, then maybe doing like the leg press or a sit to stand can help. Building up the strength around those joints is really beneficial when you have those arthritic changes in that area. If that hurts too much, if your pain is too much in that area, then maybe doing some aquatic exercises. So depending on the time of year and the access that you have, you can get really good workouts swimming or even just walking or doing lunges in the pool. I tell patients, balance things that are harder for you on the land, you can do in the pool and get a lot of the same benefits from it without the fear of falling. So doing backwards walking, sidestepping, walking on your toes, walking on your heels, doing grapevine, different things in the pool that will actually give you some of that cardiovascular benefit, getting your heart rate up that we want, without irritating the arthritic pain that you may have in your knees or your hips. And then a lot of the research and the benefits of stretching apply to arthritic changes as well. If you have more stiffness in that area from your Parkinson's disease, it may be putting more pressure on your arthritic joints. So making sure that whatever exercise you do, whether it's the pool or a walk or strength training, that you are starting with the stretching component is going to be more beneficial for you with your exercise regimen. Patients with Parkinson's disease always say, I wake up first thing in the morning and my back hurts. Is that arthritis or is that Parkinson's disease? And I usually say it's probably both, right? Arthritis is probably affecting the spine and Parkinson's disease is probably affecting the muscle surrounding it. We can't change the arthritic joints, but we can affect the muscles around that spine. And so if we can loosen up the muscles around the spine with the right medicine for your Parkinson's disease and also stretching, then you're going to put less pressure on those already arthritic spots. So making sure that you do wake up and stretch right away or stretch before your routine can help a lot. So just make sure that you guys know you're in the middle, but we have a lot of different techniques. If I didn't cover something that's limiting you, I'm sorry. There's so many different things out there, but hopefully you picked up on something that can be helpful during this process, and relying on your medical team and the whole medical team, whether it's a social worker or a physical or an occupational therapist, to really give you some insight onto what can help you keep moving, because our job is to keep you moving. So if you are not, then let us help you figure out ways to try and keep that going. And then I think any questions you guys have.
That's so awesome. Thank you so much. Maybe we could stop sharing the screen, but that was such a great overview, and you touched on a lot of, I think, things that could really help people. Let me just, there are some questions here, and also some questions in the chat. So before we go there, Ali, the videos that you showed from the University of Florida, are those available for the general public?
Yeah,
Okay.
yeah, they're on our website, movement disorders, if you just type in Parkinson's exercise.
Okay, great. And
Yep.
we'll probably have you maybe send us a few resources that you enjoy, you know, sending your patients to, and we can link them with this video at the end. And I think Ali's video here and the topic, you know, complements really nicely with some of the other folks that we've had on as well, with Becky and Julie. And I think we even had some other folks, you know, that were clinicians from ranging from Boss Bloem and the Cleveland Clinic folks, you know, just really talking about the benefits of exercise. And then I would also point folks in the direction of Giselle Petzinger, who does some really amazing research in animal models and other sorts of models on the brain effects of exercise. So, because I think there's a lot of questions, we might not get to everything here in this conversation, but we'll definitely, you know, sort of try to cover some of these questions. So great that the videos are available, and please send us any links that you have that you would, you know, want folks to look at. So just sort of covering some of the questions that were asked here. One of the questions is about how I guess one place is sort of, where would we start even trying to find a neurological physical therapist? Is there an association that you guys have, or a movement disorders association of physical therapists, or what's sort of your go-to resource for helping people find folks across the country and across the world?
So there is, I can send you, there is the Academy of Neurological Physical Therapists within the Academy of Physical Therapists. So I can send you the link, and there's a, it's broken down by states. And those are all providers who are certified in neurological physical therapy. But you don't, so that's the NCS, which is the Neuro Certification Specialist. You don't have to have that certification in order to be a good physical therapy for neurological conditions. So in general, I would always ask your physical therapist when you get a referral to a clinic, do you treat neuro conditions? Or what do you usually treat? That's usually the best way. And then beyond that, to try and find them, I can send you the link for the ANPTA. They have, again, you can go to the map, but that's just the specialist. Neurophysical therapists tend to be more at a hospital-based setting because of the need for the one-to-one for 45 minutes. So it's, when we're thinking of insurance, unfortunately, like we always have to, they're not as high of a reimbursement rate. So for Jim Smith's physical therapy clinic on the corner, they're not going to make as much money off of a neurological physical therapist because you don't bring in as high revenue of patients. So a lot of them are at hospital settings. So here we have University of Florida outpatient hospital clinics. Like if you have a Sacred Heart, I know is a hospital locally, and if they have an outpatient physical therapy clinic, that we would send them there. It's usually at the places that also have those interdisciplinary people. So again, John Smith's physical therapist probably only has physical therapy. They don't have occupational therapy, and they don't have speech therapy. So I would try and find some place, try hospital clinics, and then also ask if they have OT and speech therapy. Because usually those are where the neurophysical therapists are, because you work in that team approach for stroke and Parkinson's and MS. So hospital clinics and interdisciplinary, do they have the other components of it? And then if you have to, you can try and look on the ANPT website for in your area, who's there.
That sounds great. A few other questions here. So asking about where to find toe spreaders.
Yeah, those are great. You can go on Amazon. Actually, I swear I don't work for Amazon, but I should. They're usually the cheapest on Amazon. You can read reviews. I tend to recommend, so when you go get a pedicure, they give you those foam toe spreaders. Those are usually too stiff. So on Amazon, if you type in gel toe spreaders, They have a bunch of different ones. Some of them are called like yoga toes, and they help to spread out your toes. Some of them are too much for patients to sleep all night in. So I'll tell them, like, when you're watching TV in the evening for maybe an hour or so, put them on then, just to give them that prolonged stretch can help. And if the toe spreaders are too much, PD Fix, PEDIFIX is a company that makes them. Actually, they're for like bunions and orthopedic issues, but they're a little less invasive, but will help to keep your toes more straight. So I would start with the gel toe spreaders because they're cheaper, and they're on Amazon. And then if that's too much for you, continue with the stretching, like moving your toes up and down, pulling your toes apart, moving them in all different areas. And then if they still need a little bit less, but you want to work on it, try the PD Fix, PEDIFIX.
Great. There's also been a question here about whether how is being barefoot? Because a lot of people are, I think, mostly home now wearing maybe barefoot or socks. What's your sense of kind of what to advise people to do with Parkinson's at the home setting right now?
I like barefoot. Barefoot is great. Barefoot is probably better than slippers, and I'm sure a lot of caregivers can talk to that as they hear them scuff with their slippers around the house. Barefoot is going to help relax your foot out more. So that's what we want when you have that dystonia. So barefoot is going to be good in this if you can tolerate it. Some patients, it's painful to go barefoot just because they need a little bit of cushion. So in that sense, if you have a pair of shoes that you like for outside, I would say get the same pair of shoes for inside and wear that same pair where your feet are able to spread out a little bit more, and you're wearing them around your house with good support. But if you can walk barefoot, that would be the best, because it not only gives you more of the ability to spread out your foot, but it also gives you different sensory components. So if you have a neuropathy or something, or maybe the onset of neuropathy, getting the various sensory components around your house is good for your foot. Unless you have more like severe neuropathy where you can't feel it, then we need to talk about safety, and maybe a shoe is better. But if your sensation is okay in your foot, going around your house and being more barefoot is going to be better for the dystonia and helps with that sensory integration that can help with the dystonia.
That's really wise. And I think, the other thing is, I think wearing socks and also like those sort of loose fitting slippers and stuff. What's your advice on that kind of stuff at home?
Yeah. Socks are dangerous with slippery floors. So I would avoid socks unless they have the grippies. So I have a lot of patients who actually like they had to go to the hospital for something and have those hospital socks left in their house. Those are really beneficial because, again, you have a little bit of support, your feet stay warm, but your foot's still allowed to spread out. The slippers are my least favorite because it's similar to a flip-flop. So with a foot that's dystonic, with toe curling, when you just slip your foot into a slipper, your toes almost have to curl to keep the slipper on, right? And so we're trying to avoid that toe curling. And so if you have a slipper that your foot actually stays in and you can relax your toes, then that's okay. But those slippers that are loose, your toes are curling to keep the slipper on, and it's kind of counterintuitive for what we're trying to do with relaxing the dystonia. So if you feel like you need something on your feet, try a sock with grips on the bottom, or a slipper that stays on your foot, more like a shoe slipper than like something you slip on.
Yeah, and the same goes with probably flip-flops too, right? That you have to kind of grip. Yeah, so those aren't also ideal. So either a full-on shoe that is well fitted, that lets your toes spread out, or the socks with grippy, or the best is probably barefoot.
I say sandals are okay. People live in hot areas, you have to wear, but try and get something with a heel strap, because then your toes don't have to curl to keep it on. So something with a heel strap will help.
Perfect. Yeah, people are really loving a lot of these tips in the chat and stuff like that. So I think this comes up a lot. Ali, one of the questions is, how intense does the exercise have to be to have really any brain change. And also, there's also, every time we have someone on, people are asking if dopamine levels actually go up with exercise. Maybe, I don't know if you want to speak to your sense of those two things.
Yeah, so the research with exercise and Parkinson's disease is that's the golden question, right? What type of exercise? How much do I have to do? That's where that RPE scale came in, where I had the big circle on there. So you have to get that moderate to high intensity exercise frequently to get the beneficial changes. The stretching is not going to, unfortunately, have disease modifying effects. The stretching is going to allow you to go exercise with walking and with running or biking, where you're getting the higher level intensity that you need. Does that make sense? So you have to stretch to manage the muscles, to manage pain. But unfortunately, that type of exercise is not going to lead to the dopamine increase in your brain. That moderate to high intensity exercise for specifically cardiovascular exercise and strength training can help to increase the dopamine in your brain and help to increase the efficiency of the dopamine in your brain that will help with some of the disease modifying effects. So It's tough because you have to do the other exercises, the balance exercises and the stretching exercises just to manage your Parkinson's disease. But if we really want to get at the disease modifying effects, then we have to go at more of that intensity level that is more challenging for our patients to get. So, and I think this area is still really, it's the hot topic in physical therapy and exercise and Parkinson's disease in general. So hopefully we can learn different ways to help it a little bit more. But as of right now, we know it has to be that higher intensity exercise.
And I saw that you guys are doing some of the forced exercise. I think, were you a site for the Cleveland Clinic forced exercise research as well?
For the pedaling?
Yeah.
Yes.
Yeah.
Yeah.
Could you tell us a little bit about that?
Yeah. So there's the pedaling for Parkinson's disease. Is that what you're talking to?
I think so.
They essentially, it's a tandem bicycle where patients with Parkinson's disease are on the back of the bike and a person without Parkinson's disease are on the front of the bike. And so the patient with Parkinson's disease has to pedal as fast as a person without Parkinson's disease. And that idea of forced use exercise and forcing you to go a little bit faster than what you think you should, and forcing you to go a little bit faster than what you think you can, has a lot of the benefits of these higher intensity exercise training. I tell patients when you're starting out and you're trying to hit those high intensity marks to do more of an interval training. It's really hard to keep that high intensity for 30 minutes straight, but maybe we can break it down to start and you can do 5 minutes on, 5 minutes off, 5 minutes on, 5 minutes off, where you're working at that higher intensity levels to help you achieve some of those benefits of the higher intensity exercise.
That sounds good. Yeah, I think it was Hubert Fernandez came on and was talking about that. So I think that is the study. So yeah, someone mentioned Jay Albert to come on about his research. I think that's sort of the team there. So awesome. So what about those folks who say, you know, I can only get 5 minutes in and then I have to take a break? I know, you know, some people talk about, you know, these hour, you know, 30 minutes, 20 minutes, an hour, you know, things like that. Is your sense that that if you break it up, it's as good as, you know, doing a sustained hour? What's your sort of sense of telling people?
Absolutely. The recommendations are always really daunting, right? It's like 150 minutes a week, and that's a lot. So I think it's breaking it up. That's 30 minutes 5 times a week. And so again, I think a schedule for that, if you know that, okay, after 5 minutes of a stationary bike, I'm exhausted and I can't go anymore, I think a schedule to start would be really beneficial, and tracking your progress will show you your benefits and your progress over time to try and kind of keep you going. So I think 5 minutes, again, especially if it's the middle of your dose of meds and then you feel like I'm exhausted and I need to take a break until my meds kind of kick in again, that's perfectly okay, especially how we are now, like stuck in our houses. when you're not able to go out and you can't really rely on a gym. So if you have ways to do it in your house, it can help a lot. So staying hydrated is super important for that component of it. So making sure that if you only get 5 minutes in, that you're going and drinking water and refreshing and then trying 5 minutes again. I've broken it down enough for patients who are not moving at all and not exercising into, okay, let's just do sit to stands. So sit to stands is a functional squat. It works on strength in your legs. It works on your forward and backward balance. Sit to stands, and I know a lot of you know, like the LSVT big stretch when you stand up. If you can do 5 sit to stands in a row in the morning and then 5 sit to stands in a row 2 hours later, and try and build up your tolerance for that, your legs are going to start to get stronger. Your balance is going to start to get better. And then maybe you can build up to 10 in a row, or doing the 3 sets of 5 back to back to back. And you can apply that to a stationary bike, to a treadmill, building up your activity tolerance. The most challenging thing with building up your activity tolerance is you have to work at it every day in order to build it up, right? There's no magic. It's not just going to automatically, I can ride for 30 minutes. It's going to be one day you ride for 5 minutes, the next day you ride for 6 minutes, maybe the next day you're back down to 5, and then you're up to 7 minutes, and then you're up to 8 minutes. But keeping track of that so you can see your progress over time, and having a buddy to do that with you will help a lot.
Yeah, I mean, I think it's sort of just getting those bite-sized pieces, whatever you can manage, and building up and sort of setting goals. And I love the idea of a reward. I think we all need rewards, and whether it's I mean, I sometimes tell folks that they should grab a neighbor, go for a walk, maybe grab their favorite pastry at the end of the aisle, and then turn around and come back. Something like that you sort of have something to look forward to is so important in these sort of days where we don't have that many things to really sort of do. So so I think we're down to like the last 5 minutes or less, actually last 3 minutes. Allie, this has been really amazing, and I think so many great tips just to kind of get started, get sustaining, allow the caregiver care partners to sort of not feel like they're the only people who are needing to be the cheerleaders, and sort of that concept of the team and everyone sort of rooting for the patient in the middle is so important. So I think I think it is so great to sort of see all of these pieces, and hopefully everyone can take some tips from this and take away to keep motivated through the holiday season and the cold winter months as well. But maybe I'll give you the last maybe 2 minutes to kind of inspire us, give us sort of a message of hope. If you have any other silver linings, how you're sort of keeping positive through this time would be great to hear.
Yeah, I think some of the ways I keep positive is my patients. So you guys are the ones who inspire me to find different ways to keep you moving, and find different ways to figure out your ailments to keep you moving. So I think that you have to find what you like to do and then make that exercise. If you are not a boxer, then Rock City Boxing is not for you. If you have never liked the gym, then trying to drag you to the gym is not for you. And I think this community of Parkinson's disease has developed so many different ways for patients to get engaged, that finding what you enjoy doing, and it might be getting to know your neighbor and going for a walk with them. It may be trying yoga for the first time with your daughter remotely. I think trying different things that you haven't done before that you like to do. It should not be torture. So we know that there are benefits with specific types of exercise, but at the same time, all exercise is good for you. So don't feel like it's, oh my gosh, I have to hit this crazy mark, or I'm not going to have disease. I'm not going to have benefits from the disease. I think that part is kind of too much for patients to handle. I think we need to start by, what do you like to do, and how can we make this exercise and make it beneficial for you? So I do not like swimming, so I would never be a swimmer for exercise. I enjoy being outside and walking and running. And so that's where I find my exercise. And I hope that, especially during this holiday time, you guys can maybe try out some of the videos that we'll send you for some enjoyment. Look on your own for YouTube for exercises for people to do at home. There's crazy videos out there that are so fun. Somebody wrote pickleball and ping pong with your family. I think those are great ideas of things that are enjoyable. And then hopefully some of the tips I gave you, whether it's stretching or balance or tips for dystonia, can help you maintain that exercise that you've always liked to do.
Absolutely. I think there's no small place to start. Just, put one foot in front of the other, and or whatever you can do. Chair yoga. I mean, there's so many offerings, like you said. I think hopefully if certain things resonate with you, share it in the chat, share it amongst yourselves. I think there's, not one solution for anyone. And I think we're all just, every single one of us is struggling to kind of keep motivated and keep positive. So it's not just our Parkinson's patients or just a small, subset of the community. I think everyone is looking for ways to kind of get motivated. So I think, yeah, I agree. Like maybe calling a family member and setting a small goal. Let's check in next week. Let's try to do this for these 5 days and see if we can kind of motivate each other throughout the country, throughout the world. So thanks so much. Somebody's writing, can PMD Alliance add a page similar to the medications page on exercise resources? Yeah, so we'll try to really think about this. And if patients are also feeling that certain things have really helped them, maybe we can kind of get some sort of message place on PMD Alliance or maybe email Andrea and she can kind of link some of these things. And obviously not everything's going to fit everyone, different people are at different levels, but I think, sort of check in with your doctor, check in with your physical therapist about your own safety and precautions and things. But certainly I think, having this community to kind of motivate each other is just so great. Well, thank you so much, Ali. I really appreciate your dedication and enthusiasm, and the blog that you wrote was amazing. We'll link that. And I think this is just a great resource that people can hopefully watch over and over to kind of take away something in some of the other videos. And it's just such a lovely community of physical therapists that we have, that we're so fortunate to have on our teams throughout these centers of excellence that we have in Parkinson. So thank you for taking the time. Happy holidays.
Thank you for having me. I really enjoyed it.
I will send it back to Andrea for our final goodbye wave.
So, Ali, we always end with a wave, and we're going to put an extra oomph into it if we've been inspired to stay active even over the holidays. Have a great Thanksgiving, everyone. Thank you so much for tuning in if we don't speak to you before then. And thank you, Ali, and thank you, Dr. Subramanian. This was excellent.
Thanks.
Thank
And
you,
for those of
guys.
you who are looking for things to keep motivated, keep watching these videos. They're all linked. They're all available. PMD Alliance has done a great job of linking a lot of this content. And so especially the exercise ones specifically, I think will be very helpful to folks. So stay safe, everyone, and happy holidays.
Bye now.